Good afternoon. I hope you guys are having a wonderful, wonderful day. This is Jashima Schuler, licensed clinical social worker, and I'm here today to talk about the differences between a primary care doctor, a psychiatrist, and a psychologist, as well as a therapist. I hope this information is very informative to you because a lot of individuals do not know the role that each profession play, and how to start or where to start. So therefore, I want to give you a little bit of information, as much as I can in a short period of time. If you have any other questions, or if you want to know any other things, please do not hesitate to inbox me, or reach out to me, on my business line, or give me a call. I have no problems with consulting with you, only within my scope of practice. Okay, so we'll start with a medical provider because that is very important, like your primary care doctor. We all in our profession, our primary care doctor is very, very important because we need that primary care doctor to give us all of the information in terms of the patient's physical health. When you're going into the doctor is looking at you and making sure that you are fine. Now, when you start having certain symptoms, such as depression, anxiety, or begin to complain that your child may have issues at school, your child may not be able to focus or be able to sit down, or your child may not be eating enough, or just so many different things, that doctor, the primary care doctor, is the one who kind of medically clears everything, or to let us know what's going on. And we typically get the medical records from the primary care doctor. So with that primary care doctor, sometimes that primary care doctor will do a referral. That referral would be to a therapist. Sometimes I'm going to use me first. They may refer you to a therapist first. We all know that primary care doctors can prescribe medications for mental health as well as physical disabilities as well. So sometimes as therapists, we get the referral from the primary care doctor. And of course, we're looking at the records and seeing, what medications are being taken, We're also looking at, the diagnosis and the reason for them to come. Now, as a therapist, the therapist is focusing on the mental health well-being of the patient. And so there are a variety of mental health counselors or providers, okay? So I'll give you some. Sometimes you may have a family therapist. You may have a marriage and family therapist. Sometimes you have therapists who focus on divorce. You have therapists who conduct grief counseling. You also have therapists who specializes in trauma. You have therapists who do group therapy. And there's plenty more. You also have therapists who specializes in doing play therapy. Those therapists, they do work with children and adolescents. And so starting from age 3 years old and up. And it's really fun because, you can do play therapy. You're doing art therapy or whatever. That's another something that we can talk about with play therapy, because you'll be so amazed of how much your children tell you through play, and you not even realize it. So those are one of the things that that is what the therapists do. Now, say for instance, for me, I am very, very big on getting help, or like, say for instance, if I have a child or a person that let me go back to play therapy. Play therapy is just because a person is, say for instance, 18 years old or 22 years old or 25 years old, does not mean that play therapy cannot be done. Play therapy happens when in cases like that, when a person is operating is 22 years old, and say their age may be 22, but their cognitive functioning, meaning the way that their brain function, they're functioning as a 10-year-old, or a 10-year-old may be functioning as a 5-year-old. So there are going to be certain techniques that you have to use. And so that's when play therapy would be appropriate. I don't like to use this word because it is very offensive, but if I'm being transparent, sometimes you have children who are mentally retarded, or they could be a borderline, again, functioning at a lower level as they should. I mean, as at a lower level. So again, if they're 10 years old, they could be functioning like a 5-year-old. And then also you may have people with traumatic brain injury, or individuals who are autistic, or who are has been diagnosed with autism. Play therapy can be important. So an important piece in providing therapy. So in my case, as a therapist, what I typically do is, of course, I can diagnose an adult or a child with ADHD, that is attention deficit hyperactivity disorder. Um, and it's not ADD, it's attention deficit hyperactivity disorder. The short words that you hear a lot of people say is ADHD. You have ADHD predominantly inattentive type. That's when the child or an individual cannot focus well. They have issues with focusing. And then you also have predominantly hyperactivity type, and that's when they're constantly hyper, very impulsive, and they can not sit down, and they just all over the place. They're running, they're climbing, you're trying to get them to sit down, they can't do anything. And a lot of times parents feel like there's nothing wrong with my child, because when they're home they are fine. And guess what? You're absolutely right. A person, or an individual who is struggling, or experiencing ADHD, they do very well with one-on-one. But when you are in the room or in the classroom with a lot of other people and one teacher, that one teacher cannot possibly give that child what he or she needs, because they have other children that they have to tend to. So therefore, that's why sometimes as parents, we may not see the behavior that the teachers or the other people that are out in the community are telling us, because the child is fine with us. Or you may have the child using electronics like video games and stuff, things that they like, that don't require them to have to use a lot of, what do they call it? For them to have to think a lot, So that's something that they like to do. They like to play the video games and stuff. So no, you're not going to have any issues out of them. But when it requires them to have to sit in a structured environment and be quiet and listen to the teacher and all of that other stuff, yes, that's when those symptoms are going to come out. So you may not see them at home, and the teacher may see them at school, because that's typically where the behaviors are mostly shown. So when I have that, if I'm seeing signs of ADHD, or if I'm seeing signs of possible autism, or any other serious diagnosis, what I do is, that's when I'm going to my psychologist. Psychologists, they focus on the emotional and behavioral and organizational skills of the person. They're studying your brain, okay? So they do a series of tests that they have been trained to do. Psychologists can provide therapy. They can provide therapy, and most psychologists do. They still do therapy as well. But what the psychologists do is they diagnose the person to determine the treatment based on the observations and what the measurement tools that they used to and psychologists also do IQ scores as well. Like they help us out, especially like when we're trying to get our child an IEP or something like that. They do IQ testing and all that other stuff. Psychologists, whatever they specializes in, they do it. Psychologists also say, for instance, if you're trying to go for disability, and you may need to see a psychologist. Yes, they will take you. Say, for instance, if you're trying to apply for disability, you may get referred to a psychologist so that they can, again, do testing, because again, they are looking at your brain functioning. Okay, so that's focusing on the emotional, behavioral, and your organizational skills. Excuse me. So how does that tie in with me as a therapist? When I get the results back from the psychologist, they're going to tell me what measurement tools that they use. They're going to give me full details in terms of what they did, the person, their background and all of that other stuff. And then they're going to give me the diagnosis. And the biggest piece on there that is so helpful is their recommendation. Whatever they recommend, that's the road that I typically try to follow. So therefore, if the child is deemed to, or the adult or whomever, is deemed that they meet the diagnostic criteria, and they are autistic, or they do have ADHD combined type. That means that they're dealing with both. They are very hyper, plus they have issues with being able to pay attention to things. Whatever they are whatever they are recommending, that's what I'm going to do. For the most part, this is when a psychiatrist come in. Now, a psychiatrist is a medical doctor, and they specializes in mental health and substance abuse. And they assess both the physical and psychological problems of the individual. So this is where it's important, where they're gathering all of our information. Okay, so they're getting information about what's going on in therapy, because we're getting background information. We are getting information about, your family history, all of that stuff. And so what they do is they're able to prescribe medication. Some psychiatrists, I have not met many at this point, do provide therapy, but for the most part, the psychiatrists provide medication management, if you've ever heard of that. So, they provide the medication. And so that's how we all work together in this whole thing. And so we give updates, and this stuff is very important, because if you have a person who is experiencing bipolar disorder, the medication that people take for bipolar, you have to get your blood tested a certain amount of time to make sure that all your blood levels are fine and you are okay. And so the medical, meaning your primary doctor, needs to know this stuff just as much as the psychiatrist needs to know this stuff. So they are dealing with people with some serious mental health issues, and so the psychiatrist is there to assess them, and they will make alterations to the medications. If this isn't working, then we may try it this way. But those are the difference between the primary care doctor, the psychiatrist, the psychologist, and the therapist. I hope that this was very informative for you. I try not to take too much of your time, because I like for my videos to be short and to the point. But if you have questions, please do not hesitate to inbox me. And again, I will definitely give you information within my scope of practice. I thank you so much for listening, and I hope you continue to have a blessed day. Bye.